have Amy Beardmore from University of West of England, and we have Professor Thomas Scharf from University of Newcastle. And I'm going to ask Amy to speak first, and then we're going to hear from Tom. Each speaker is going to present for 15 minutes each, and then we're going to have some time at the end for questions. And as I mentioned before, please use the chat function on the right hand side to type in some questions as we talk, and we'll keep an eye on those. So let me introduce Amy. Amy's going to talk to us about the Apart But Not Alone project, looking at neighbourhood support and the Covid-19 lockdown. Amy is a research associate in public health and community development at the University of West of England. Amy has also undertaken some important research on social prescribing, and her MSc dissertation in public health looked at this topic in relation to the workforce and people's experiences of working in the sector. And she's also published on the topic of social prescribing. So Amy, a very big welcome. I'm going to hand over to you for the first presentation.
Brilliant, thanks Paul. Just wait for my slides. Okay, great. Hopefully everyone can see those. Yeah, so I'm going to talk to you a bit about our project that we've been working on, Apart But Not Alone, which is specifically about neighbour support and how that's functioned during the COVID-19 lockdown. Okay, brilliant. So I'm sure I don't need to remind too many people here about what's been going on for the past few months, but back on the 23rd of March, we were put into a full, quite strict lockdown in the UK, and that limited exercise, banned gatherings of 2 people, and we were only allowed to go for like essential things like food supplies and medication. And if you recall, that situation developed really rapidly, so it led to a lot of people kind of, in the end, kind of organising themselves on a local level, and quite often that was happening before statutory and voluntary organisations were able to mobilise help as well. So to give you an example, in my local area, I live in a small village in South Gloucestershire. I set up a Facebook group here for the COVID-19 outbreak on the weekend the lockdown came into force. On week we had 600 members, all of whom were really keen to help and volunteer. And our main aim there was really to make sure that everyone who lived locally had a contact. So we also leafleted streets, made sure that everyone had either a link into the Facebook group or a contact that they could call if they needed something. So within our centre, the Centre for Public Health and Wellbeing at UWE, we started talking about this and realised that something quite special was happening, and it wasn't just happening where I live, it was happening across the whole country, but also across the whole of Bristol. And we also had colleagues who were working at Bristol Aging Better who were involved in those groups as well. So as we started talking about that, we realised it'd be great to do a really good quick piece of research and get on board quite quickly and try and see and capture what was going on during the lockdown. So in order to do that, we pulled together a team of people. Let's move the slide on. So this is our team that have been working on the project. So top left is Matt Jones, and he has really been driving the project from the start. He's a colleague of mine that I work with on the Bristol Aging Better project, along with Joe White, who's in the bottom right-hand corner here. And during our time working on Bristol Aging Better, we've been really evaluating quite a lot of community development initiatives that seek to reduce social isolation and loneliness. So it's an area of interest for us. And then obviously we're then particularly interested in what the context of COVID-19 was going to do to those vulnerable groups and to those community development projects. Other UWE colleagues who are also interested in this, including Michelle Biddle, who Matt and I also work with on another community development project, as well as colleagues who are interested in social capital theory or quantitative or qualitative methodologies. So there's quite a large group of us from the centre working on it. We've also enlisted the help of 2 of our community researchers who are peer researchers who've been working with us to evaluate Bristol Aging Better over the 5-year programme. And they're helping us with some design of the research, but also some analysis and things like that. And we also have some public contributors from people in Health West of England who are performing the same task. So it's a really big, varied team with a lot of skills. Okay, so There are 3 project stages. 2 are still in progress, 1 is finished. So the first stage is the survey. So the first survey we did was looking at the characteristics of neighbour support within the context of that early stage of the lockdown, and specifically how that might be associated with area-based social deprivation. At the moment, we're working on stage 2, which is the qualitative side of things. So when we put survey 1 out, we asked people if they would be interested in taking part in further research, and from that we were able to get this sample of people to talk to for the qualitative element. And for that, we're interested in social capital and the role social capital might play in diverse neighbourhood responses to COVID-19. And I'll talk a bit more about social capital a bit later. And then the third element is also currently in progress. It's the second survey. And in that one, we're really interested in community spirit and how that looks within the context of the easing of lockdown that came into place around the 10th of May. And then also looking back and comparing that to what happened in the early weeks. Okay, so this first survey went live on the 2nd of April. And it was specifically directed at those people who were giving some kind of support to their neighbours during the current coronavirus outbreak. It consisted of 24 questions, and they focused on who people were helping, how they were helping those people, the kind of support that was being offered, and the ways in which people were keeping in touch with people in their local community. So a lot of those questions were multiple choice. Some had like a free text aspect to it where people could give a free text answer, descriptive answer. But we also asked people to give us their postcodes because we were interested in that social deprivation element as well, to see if we can track where people were responding from. So in order to promote the survey, as I said earlier, I'd already set up that Facebook group near where I live, so that was the first place that it went. But we also had those contacts to the other Facebook groups through our colleagues at Bristol Aging Better. But also by that time, I think someone had helpfully put together a list of all the Facebook COVID-19 groups. So we managed to get it out through all of those via the administrators of those groups. We also sent it out on the staff intranet and advertised it internally at UWE. We publicised it on our Twitter feed, which hopefully you can see here. Our handle is @apartalone. So if you want to follow us, please do. And also members of the team had their own specific contacts that they sent it out to. So some people knew local councillors and had connections with specific BAME groups or disability groups. So we really tried to cast the net as far and wide as we possibly could to get the survey out there. So this is just a flow chart then of how we sort of gathered our responses and ended up with our data set. So the study is focused on the Bristol built-up area, which consists of the city of Bristol, most of South Gloucestershire, and an urban fringe of North Somerset. So we started off, we think, sending out to approximately 17,400 people, of which 1,255 actually clicked on the link. And then once we'd taken out those that gave no further response or left an incomplete postcode or were outside of that study area, we were left with 554. And then there's that screening question about whether they'd actually offered neighbour-based support, and if they hadn't answered positively to that, then they were taken out. So we were left with a final data set of 539. Okay, so I'll just give a quick overview of some of the people who responded and then some of the responses they gave to the questions. So the survey closed on the 28th of April. And there's something quite interesting happening here with gender and ethnicity and race in particular. So you can see we had just over 80% response rate from female, people identifying as female. So that's quite interesting itself. We have some theories about what's going on there, but that's also something we're trying to explore a bit more in our qualitative work and other aspects of the research. And similar story really with the race stuff, because we know that Bristol has a BAME population of around 14%, so that 5.3 is actually very low. And again, we have some thoughts on why that might be, but we're looking to explore that more in the other aspects of the research. We had a real range of responses across age groups, but most responses came from that middle adulthood age group, sort of 30 to around sort of late 60s. And as I said before, we were focusing on the impact of areas of deprivation on people's responses and what impact that might have on community involvement where they were. So anyone who isn't familiar with this, the Index of Multiple Deprivation, or IMD, is a way of stratifying areas according to their levels of deprivation. So IMD would be the most, IMD 1 would be the most deprived, and IMD 10 the least deprived. So although we had a good mix, you can see that there was kind of quite a few more answers from the higher IMD areas where there was less deprivation. So we asked how neighbours were keeping in touch with one another. Reassuring to see talking at a safe social distance was up the top, so still some face-to-face contact going on. But the majority seemed to be happening online or via text messages and phone calls, that sort of thing. We also asked what actions people were taking to specifically reach out to vulnerable people. So again, as I mentioned earlier, there's a lot of people putting leaflets through doors or contacting neighbours whose details they already had, that kind of thing. We also asked which groups of local people they had actually reached out and aimed to support. Again, not surprisingly, given the context of the virus, top of the list was people self-isolating, and second, people over 70 years old. And those categories aren't necessarily mutually exclusive because of the need for a lot of people in the older age groups to have to shield themselves from the virus. Okay. And we also asked what kind of support you've given to your neighbours. So there's some quite nice ones here. There's the obvious things like shopping and things like that for people, but there's things like sharing humour and lifting the mood, window art, rainbow pictures, identifying local helpers, that sort of thing. Okay, so overall, our findings are kind of briefly as follows. So respondents were obviously using a wide range of approaches to communicate with their neighbours, and they were really reaching out to those vulnerable groups. The neighbour support spanned all adult age groups, including older people who were categorised as being at risk. Respondents from more deprived areas were less likely to strongly agree that their neighbours were supporting each other well. And again, we're not entirely sure that we know the reasons for that yet. It may be that there are just more complex support needs in more deprived areas, which is illustrated by the kind of fourth finding here, which is that respondents from more deprived areas seem to be more likely to report addressing the needs of people with disabilities, reduced mobility, little or no access to outdoor space, and to those experiencing financial difficulties. So that's the first survey. We're now currently working on the qualitative interviews. So as I said before, we did ask people if they wanted to take part in further research. And from that, we gathered a sample together of people that we wanted to interview. We went for a maximum variation sample. So we wanted to get as many people from a range of age groups, ethnicities, gender, IMD groups, all of that. So we could actually get a real kind of mix of views. We were aiming to interview 20 to 25 people. I think currently it's around 10, so we are still very much in the middle of this work. We're doing in-depth interviews. They tend to be around an hour long. I did one that was about an hour and 40 minutes, which is sort of slightly unusual, but they tend to be around an hour. And as qualitative research, we're always interested in our own place in the research. And so what's really interesting and unique about this piece of work is that we're actually all living through the experience of the people that we're interviewing. So that's added a really interesting element to it, I think. So I'll just give you a couple of quotes from the qualitative interviews we've done so far. This one's quite interesting because it sort of tends to buck the trend of what you might think about community spirit and people looking after each other. She says, I think people may regard us as a bit detached. We know each other and we do our best to support each other if needed, but we're not needy. One might say it's a slightly sterile community. So that's quite interesting because it sort of goes against what you sort of think's happening out there, I think. And then this next one I thought is particularly poignant because it was a lady who talks a lot to her neighbour but doesn't necessarily always see eye to eye with her for political reasons and other reasons. But it's interesting, she said she'd been talking to her the other day and the neighbour had said, I could die here and never leave the house again, which is a really poignant quote, I think, and something that's very real for a lot of older people and actually something that my own dad has said to me throughout this crisis. So there's also another thing that she said, which was interesting, which is that she'd offered this lady her laptop and to let her use Skype to keep in touch with her family, but this lady has actively resisted. So there's another element of maybe older people either not being online or not wanting to be, and whether that excludes them. And then this one's really interesting. My colleague Matt Jones interviewed this person and they'd actually had the virus. And so he says here, I couldn't breathe, I was sick, it was horrific. and he talks about how his experience in hospital would sit with him for the rest of his life. But he also talks about how that experience has galvanised him and how he kind of now has something in common with people around him who've also had friends who've been unwell. So they're just some examples of the sort of things that are coming out of our qualitative research. And I just wanted to say a quick note about social capital theory. I'm not an expert in this area, but we're going to be analysing our qualitative interviews within the framework of social capital theory. And very briefly, that just refers to the resources and connections that people have access to in society that can influence their ability to navigate systems or just to generally do well in life. So one idea is that social capital can be as important to people as economic capital. And whilst that can be a beneficial thing, it can also be detrimental or perpetuate inequalities. So essentially, we're looking at various forms of community within this, and they all rely on different connections and structures. But what we're interested in is the role that their social capital has played in their experiences of neighbourhood support in the context of the COVID-19 lockdown. So phase 3, just very quickly, is the second survey. This is in progress, so I won't dwell on this too much because we're awaiting the results. It went live on the 27th of May. Again, it's people who said they wanted to take part in future research. 14 questions this time, looking more specifically about community spirit in the context of the easing of lockdown. And we've had around 296 responses so far. So it's a really good response rate, actually, and much better than we had thought. So I just wanted to say, just reflect a little bit about the possible implications of lockdown on community development for older people. So one thing that's come up quite often is that because older people are so kind of active in their communities so often and so used to volunteering their time, there's a question, I think, around how being labelled as vulnerable throughout this crisis will affect both their own sense of value and how society values them. So there'll inevitably be some kind of civic loss if older people are no longer able to volunteer their time as they usually would. But also, I think there might be an impact on their sense of value and how they perceive themselves as contributors to society. There's also some question around how many older people have fallen through the net throughout this crisis. So how many people have kind of just been left out of services and not had that contact with anyone. And I think we'll discover that in the fullness of time. But on a slightly more positive note, one thing that comes up a lot in our work at Bristol Aging Better is the potential for more intergenerational activities that move away from specific age bands, like things being specifically for the over 50s and so on. And there's some anecdotal evidence from the core work that we're doing that's happening during lockdown as well. So there's this nice quote here from someone I interviewed who said, unless they're actually next door to you, you tend not to see the younger people, because we have this weird thing where old people speak to old people and young people talk to young people. Having something like this means there is more of an exchange of communication. So I think there's real potential there to get something positive out of this. So I know I'm running out of time, so I'll just whiz over this. This is our project timeline that just illustrates how rapidly the research has moved. The most important thing to say here is we do already have a paper submitted to Emerald Open Access, which is based on our first survey. And the beauty of that is you can read that whilst it's being peer reviewed. I don't think it's quite gone live yet though, but we're hoping it'll literally be within the next day or two. So please do follow us on Twitter @ApartAlone. And that's where most of the updates come in. You can read an initial findings report on the UE repository, but that's kind of pre the end of the first survey, so it's a little bit out of date. And do look out for that open access article, and email me if you have any questions. And thank you very much.
Thank you, Amy, for a really interesting presentation. It's a real treat to have findings presented that are so current. And are so highly relevant to what people are experiencing across their neighbourhoods. And I think, while it's early findings, it shows some really interesting or really informative insights into the different ways in which older people might be experiencing exclusion across their neighbourhoods.
Thank you.
So I'm sure people will have lots of questions for Amy. If you could just hold on to those, write them down on a piece of paper around you, and we'll come back to those questions. So please don't lose your questions, hang on to them. But we're now going to move on to our second guest speaker. I'd like to welcome and introduce Professor Thomas Scharf, Tom is a professor of social gerontology in the Population Health Science Institute at Newcastle University. Tom is also president of the British Society of Gerontology, and he chairs the Age Friendly City Group in Newcastle. He's a fellow of the Academy of Social Sciences and has held visiting professorships at the Universities of Manchester, Kiel, Vienna, and Galway. Tom has written extensively and done extensive research and work around social exclusion, inequalities in later life. And his latest book, co-edited with Kieran Walsh and other colleagues, is all around the topic of social exclusion in ageing societies, bringing together interdisciplinary and policy perspectives. And Tom's going to speak about loneliness in later life during COVID-19. So welcome, Tom, and over to you.
Thanks. Okay, thanks very much for the invitation. It's obviously a really big week in Bristol, and I'm delighted to have been invited to at least virtually share some of the excitement around, in this case, loneliness in later life. So what I want to do is I just want to say a few words in relation to what we know about loneliness and what I think are some of the characteristics of loneliness during this lockdown period. I think there's an awful lot that could be said. I'm going to have to cut a few corners in terms of the arguments that I'm trying to make, just to keep to time and to allow some sort of discussion. But the starting point for my presentation really is the growing interest in loneliness, which we've charted, I think, since certainly since 2010, but some of us have been interested in loneliness for a good number of years before that. And there's a set of reasons why people are interested in loneliness, not least because of the impact of loneliness on reduced quality of life and well-being of individuals. But we know now from a wide body of research that poor social relationships are linked to premature mortality, to a whole host of physical and mental health conditions, such as risk of cardiovascular disease, dementia, depression, all sorts of health conditions. We know that people who are lonely are more likely to be using medications, more likely to be using and abusing alcohol. But we can think of loneliness at the individual level, but we should also probably be thinking about the wider impacts of loneliness on society. And some of the ways in which I like to think about this is in relation to impacts on the wider social networks that people have. So if you know somebody who's lonely within your friendship circle, within your family, what is the impact of that on your own well-being, on your relationships with that person and with other people? We can also think about impacts on communities, right? Amy's already talked about, sort of neighbourhood interventions, if you like, in terms of tackling isolation and loneliness. But these are repeated right across the United Kingdom, right around the world. So there's a major investment of society in relation to tackling loneliness, reducing isolation. And we can then think of the broader impacts following on from health and social care usage, in terms of the ways people who are lonely may be using health and care services disproportionately, maybe visiting their GPs for consultations purely on the basis of being lonely rather than on the basis of any physical or mental health condition. They may be more likely to access emergency hospital care or be readmitted as emergency into hospitals. So loneliness has this sort of broader context, which is, I think, is really important to think about when we then come into a focus on loneliness during COVID. And this is where What I'm trying to do in this presentation really is challenge some of the narrative around an epidemic of loneliness. So what we know potentially are the impacts of lockdown on people's personal social relationships, right? Especially the relationships that people have in later life. That loneliness may be attributed to reduced contact with family, with friends, with neighbours. People may be disconnected from work colleagues. They may have fewer opportunities to participate in social, civic and cultural activities outside of the home. People may experience loneliness as a result of loss and bereavement. And then there are all sorts of questions around people's sort of digital connections that have come to the fore during this period. So we can think about, direct ways in which the experience of the pandemic might lead people to be more lonely. And that certainly is the narrative that has been developed in sort of media representations, and then partly also in policy and in government. So, we are, whether we're in the UK or Ireland or in other countries around the world, the newspaper headlines, that sort of what we see on websites is broadly the same. It's around this idea of a loneliness epidemic, where society needs to come together to respond to what are perceived to be the disproportionate risks faced by older people in relation to limited personal social relationships. Right, so there's this question of whether coronavirus has then generated, especially in later life, an epidemic of loneliness. So this is where the science really starts to help. So what I've done is, in sort of preparing my talk, is I've gone back to what I think researchers know and should know about loneliness. And the first key point is that basic distinction between loneliness on the one hand and social isolation on the other. That these are related ideas, but as researchers, we need to keep them separate. So loneliness is regarded as that subjective and negative experience, right? It's perceived as a gap between how we'd like our social relationships to be and how our relationships are in practice. Right? This is referred to in sort of scientific research as the cognitive discrepancy theory, the unpleasant experience that occurs when a person's network of social relations is deficient in some important way, either quantitatively or qualitatively. So loneliness is that individual subjective experience. Isolation, on the other hand, is regarded as a more objective experience. It reflects an individual's lack of contact with other people, whether that's family contacts, acquaintanceships, friendships, potentially connections to service providers, right? You often hear about older people whose only contact during a week may be a home care worker, a Meals on Wheels type system, right? Those are important relationships that people may have in later life. But we also know that isolation may not just be a negative experience. Some people may choose isolation and be perfectly happy with that. Loneliness is that negative experience. We also, when thinking about loneliness, and that's my main focus rather than isolation, is we need to sort of disentangle what we mean by this, and there are variations on loneliness. So Weiss, writing in the early 1970s, made that important distinction between social forms of loneliness and emotional forms of loneliness, right? The emotional loneliness is that disconnection from a confidant, somebody who one can confide in about the sort of things that really matter to you, whereas social loneliness may be characterized as missing that supportive social network, the type of engagement where you sort of seeing people on a regular basis. So that's an important distinction, because people may experience a social form of loneliness without an emotional form of loneliness, vice versa, or they may experience them together. But if we're to respond to those types of loneliness, we'd need different types of interventions. And we also know that loneliness varies according to duration. So some people may experience loneliness in a transient form, something that passes from time to time and over the course of a day. Other people may experience this in a chronic form. People may be lonely for their entire adult lives, where there's a severe mismatch between how they'd like their social relationships to be and how they are in practice. People may experience loneliness in that situational form, experienced as a result of migration, bereavement, retirement. And other people experience loneliness at different times of the year that varies according to the seasons. So there's a particular focus at Christmas, but maybe at other times on loneliness during the summer months for some people. What's also useful, I think, is in understanding some of the basic features of loneliness, is to think of this as a life course issue, that individuals may experience loneliness at different points in their lives, and that will vary as their personal circumstances change. That loneliness may be characteristic of certain life stages. So some people may experience the transition of their teenage or adult children out of the home as being a particular loss. Others may, of course, experience that as a gain. There's a strong gender dimension in this, I guess. There may also be a feature that loneliness is characteristic of advanced old age, as people's personal social networks, their relationships are depleted through loss and not replaced with new people joining the network. And then there are all sorts of life transitions that disrupt personal social relationships that may also then be associated with increasing risk of loneliness. Moving home, relationship breakdown, migration, retirement, onset of ill health, all sorts of features in those lines that disrupt one's personal social relationships. And then, reaching into other aspects of sort of life course research, we can think of loneliness as potentially as a cohort issue. So there is work that has been done looking at the impact of AIDS and HIV on gay men at the time before the antiretroviral therapies emerged, where individuals' social networks were considerably depleted and then not replaced. And those people may have experienced all of those losses in the 1980s, 1990s, and continued into sort of their later years with diminished social networks. And this is where I would feature maybe the idea of COVID-19 perhaps as a life course issue, that we're experiencing now a considerable loss of life, that for some people their social networks will be seriously depleted, and people will then carry that forward into their later years. So we can think of COVID-19 and loneliness perhaps as a life course issue as well as a cohort issue. So that's some of the science. And what I want to do now is to move into the sort of more difficult area of the statistics on loneliness, right? How many people in later life, what proportion of people in later life are very lonely? And when I talk to groups of people of all ages, and ask them what proportion of people do you think are lonely, the answers I get are, I've not got a lot of hair, but they'd make my hair stand on end, because people greatly overestimate the risk of loneliness in later life. This is absolutely quite common. But right from the 1940s, the early surveys that were done, right up to the present day, typically we have between 7 and 10% of older people who identify themselves as being often or always lonely. And that proportion hasn't really changed very much over time, that intense forms of loneliness affect only a minority of the older population, but with demographic aging and rising numbers of older people, that 7 to 10% covers a larger number of people. Bringing this sort of more up to date, the Office for National Statistics has been conducting their own surveys looking at the prevalence of loneliness in later life. And this just confirms that general picture that intense forms of loneliness are relatively rare within the population, right? In their survey from 2016 to 2017, they identified 5% of people aged 16 and over as being often or always lonely, and then other higher proportions feeling occasionally or sometimes lonely. I would challenge anybody to distinguish between what is sometimes and what is occasionally lonely. It's not a great question, but there we have it. And this is the really killer slide in terms of the prevalence of loneliness in later life, because, you know, as society, we're culturally raised to know that old age is associated with loneliness. It's just that the evidence challenges that idea. So if we take the set of bar chart that's sort of left of the screen, these are the people who are often or always lonely, and the two right-hand columns, the blue and the yellow column on the right, are the proportions of people 65 to 74 and 75 and over who are often or always lonely. And what you can see is that those lines are much lower than the lines that relate to people who are younger, who are earlier on in the life course. Right? So let's, you know, bring that forward a little bit. And, you know, that just this week as I was preparing my slides, I was able to benefit from the Office for National Statistics' most recent work on the prevalence of loneliness during COVID-19. And it's no surprise that they find that the proportions of people who are reporting feeling often or always lonely are relatively static at around 5%. Now that is a large number of people spread across an entire population, 2.6 million people. And if you feel lonely, this is really damaging, and we need to think about how we respond to that. But the greater risks of loneliness were not amongst older people. They were amongst people of working age who lived alone, people in very bad or bad health, people who were renting their accommodation, people who were single, who were divorced or separated, but not especially older people. And these are the numbers relating to the prevalence of loneliness during those months, during April and May. And we see for people aged 70 and over, those who are often represented as being at the greatest risk of loneliness, that the proportions are actually relatively low, 2.9%. 4.5% of people aged 55 to 69. So the risk, just in terms of age, it would suggest that if we, you know, were reporting this so accurately, we'd say that there's a diminishing risk of loneliness in later life. So, you know, this starts to raise all sorts of questions, really interesting questions for social gerontologists. You know, given what's been going on, why are more older people not reporting loneliness? Looking back to the sort of the theoretical approach to loneliness, how has COVID-19 affected older people's expectations of their social relationships? How has COVID-19 affected people's achieved social relationships? You know, and really, you know, what has been the response of society that has maybe helped people to overcome their risk of loneliness? Is this to do with, with neighbour support, as implied perhaps by, the work that Amy was presenting just previously? Just move my slide on, there we go. So my explanation here is leading away from the idea of us experiencing a loneliness epidemic in the United Kingdom, but what we really have is an ageism pandemic. Right? We've seen the way in which aging and later life have been represented in media, in policy, has been, pretty challenging for those of us who are committed to a more balanced view of aging and later life. So if ageism is the complex, often negative construction of old age, which takes place at the individual and the societal levels, what we've actually seen is a continuation of the language of a loneliness epidemic, the association of late life with vulnerability, with decline, with decay, which was represented in the media right through, right since 2010, but probably a long time before that, that associates old age with loneliness, but disproportionately, and actually is dangerous in the sense that it misses the appropriate target for loneliness interventions, which may come earlier in the life course. Now, I don't want to be misunderstood there. Loneliness in later life is an important issue, but it's not of the magnitude that people often imagine it to be. And because it's not of that magnitude, it means we can actually intervene to do something about it. And this is where my intervention would be shaped. Is what we need really is a whole system response to loneliness, but not to separate that out from a response that involves a much more coordinated aging strategy at the national level. It's pretty shocking that we don't have a proper aging strategy in the United Kingdom to reflect the challenges and opportunities associated with demographic aging. And for my two penn'orth, I'd focus on a rights-based approach that respects older people's rights, that eradicates ageism and age discrimination, that tackles the structural sources of inequality, and also that promotes solidarity between the generations. So that is all what I have to say on this particular topic. Thanks very much for listening, and I'm really looking forward to some of the questions that will come through.
Thank you, Tom, for a fascinating presentation and for inviting us to think more critically about the association of loneliness with older people and older age. So thank you again, Amy and Tom. This is now a time for people to post questions in the message box on the right-hand side. So we've got a question here. Oh, wow. Okay, they're all flooding in. Can you see them? And maybe people could indicate who they're directing their question at. So if you look at the first question there from Ian, can you see that, Tom and Amy? Ian says, loneliness is an issue exacerbated by the current pandemic. So I think this question's more directed towards your work, Tom. In light of the ageism pandemic, how do you think in policy terms and delivery of services the sector can ensure that it doesn't reinforce ageist stereotypes that old people are lonely and isolated, helpless? Some of the stereotypes.
This is a really good question, something I've been thinking about, having done research on loneliness now for over 20 years almost. It's because when I started, what we were trying to do was to demonstrate that loneliness was a key issue and to show the ways in which loneliness diminishes well-being in later life as part of a multi-dimensional set of disadvantages. And I think having identified loneliness as a key issue, which had been ignored in policy terms, over the last 10 years, we've seen a considerable investment of energy in trying to tackle loneliness, initially in later life, but increasingly right across the life course. Some of that, I hesitate to say it, but I feel has probably been unhelpful in terms of perpetuating negative stereotypes of aging and later life. And I've started to want to hold back from talking so much about loneliness, because I do a presentation like this, and then people will go away and think that loneliness is a really important issue in later life, not necessarily looking at the statistics. So I think in terms of practice responses, we need something equivalent to sort of anti-oppressive practice in social work. I think we really need to challenge fundamental assumptions. And we also need to make sure that the message that is there at the policy level isn't one that reinforces negative stereotypes on aging. So the fact that we have a Minister for Loneliness, but we don't have policy on demographic aging, I think really speaks volumes to where loneliness is situated within public discourse.
Thank you, Tom. Amy, there are two questions there for you about bias in your sample, about gender distribution, and about, can you see those questions, Amy?
Yes.
And one about the role of technologies supporting older people during COVID-19. Would you like to respond to those two questions?
Yeah, of course. So, yeah, I touched on during the presentation the high level of female respondents, which I think this is what this question is referring to. The thing about it is we're not really sure why that is, but we have our suspicions. And sort of certainly through the qualitative work that we're doing, there's been a lot of anecdotal evidence that emerging that women are really taking on a lot of the burden. One woman I spoke to said that she felt like a kind of protective barrier to her family, that she had to kind of keep them from the kind of horrors, if you like, of the virus and all the difficulties that came with it. And so I think there is some evidence that women are maybe taking on a bit more of that side of things. But then that's not to say that men aren't also supporting and doing the practical help, and they just may be helping in other ways, or they may be less engaged with the online side of things. That may be more where women are thriving, doing the online activity, and men are offering practical help. Or it might just be as simple as men don't complete online surveys. So there could be a number of things going on. So, but we, as I said before, we are really hoping to explore that a bit further in the qualitative work that we're doing. And regarding the technology, one of the problems and limitations with our survey, and we're more than aware of it, is that just due to the nature of the virus, we weren't able to take paper copies out to people. So that would have really limited sort of how far we would have been able to spread the word. So we have mainly had responses from people via online platforms, just because that's the nature of it. But we are very aware that that's a limitation, and that will also have limited our ability to get to BAME groups as well, I think. And also because we would ideally might have produced surveys in different languages, but because we moved so quickly, and because of the context of the virus, there were obvious limitations.
Thank you. Thank you for collaborating there on your study design. Tom, you can see the questions there. Are there any particular questions you'd like to?
Well, I would probably pick up on Paul Kahn and Kate Jopling's point there about playing off the generations against one another, which would not be my intention, as entirely undesirable. But I think, being aware of the magnitude of the issue is really important in terms of doing something about it. Now, we've seen how inept government response has been faced by a pandemic, right? Responding to epidemics and pandemics is clearly something that is really difficult. So if we frame loneliness in that sort of language, it really removes from individuals, I think, the responsibility to do something about it. So what I'm trying to do by, drawing attention to the risks of loneliness that people face is to say, actually, this is much more manageable. And the example I would always use, if we say that loneliness affects 10% of older people, if there's a street with 10 houses occupied by 10 older people, you have to find one house occupied by somebody who's often or always lonely. And to deliver some type of support that helps them to come to terms with their loneliness or alleviates their loneliness. And also this is an argument for interventions right across the life course, which really backs up the point I was trying to make about loneliness as a life course issue, is that many students who leave home and go to university for the first time, just to take one group, experience that as a major, experience loneliness for the first time in those initial months, because their expectations of the social relationships that they are going to have are not fulfilled or can't be fulfilled in some important way. So we need to be intervening for those groups as much as we need to be intervening in later life for those who experience loneliness, in their 70s, 80s and beyond. So I would not want to frame this as an intergenerational issue. I would want to frame this as something that brings generations together, that necessitates a coordinated response. And this is where, the important work of the Campaign to End Loneliness really comes in, is that, what are the, how do we intervene? I would be arguing, in other work for anti-poverty measures as a major route into reducing loneliness, that facilitating people's ability to sustain social relationships with the right income to do that. But that isn't regarded as a practical measure to tackle loneliness in the current framing.
Thanks, Tom. It sounds like you've got some people on board with you there as well. Thank you for a thoughtful response. Amy, there was a question here. I'm going to come back to you. There's a question about how support across ethnic groups might differ, or that support might differ according to ethnic identity and community. I wonder whether you wanted to comment on that.
I mean, again, due to our response rate from those communities, it's very difficult for us to really say what's happening, just because we haven't been able to connect into them, which, as I said, is a limitation. However, again, we are sort of getting more of a picture of that through our qualitative stuff. And one thing I should have said actually is that from our sample, we're now hoping to snowball. And so we are sort of through those early conversations hoping to reach out to more of the BAME community to get a sense of what's going on, because we know there is stuff happening. It's not that stuff isn't happening in those communities, it very obviously is, but I think they just maybe operate in different ways and maybe aren't so tuned in some cases to the social networks that we've gone through. So it's not in any way to say that those communities aren't very much working within those communities to help one another, but we just unfortunately haven't got to them yet, but we will do.
Great, okay. And just present your work midway through the research and get some of that feedback and to be able to take a look at the study. Yeah, it sounds like you're really thinking about solutions around that. Tom, I noticed there were some questions about how do we move towards a national ageing strategy? How do we get an Older People's Commissioner for England? I wonder whether you've had any thoughts about how we get those balls rolling.
Well, my thought is that at some point we're going to have a public inquiry into what's been going on. And, part of I think this is where, not having had an ageing strategy in place has meant that we haven't been able to protect the lives of older people who are disproportionately affected. Over 90% of deaths have been deaths of older people. We haven't been able to protect people in care homes, which has been an incredibly shocking situation, which is, why a commissioner on the rights of a commissioner for older people is probably a good idea. So I think as part of an inquiry and thinking about what we could do better, trying to put pressure on government to develop an ageing strategy, I would say, if we want to prevent the next pandemic having the same, we're not any better off now in terms of preventing what might happen around the corner than we were back in February and March. So if we want to protect ourselves from the risks of future pandemics, we'd better start working on this now. I don't see any appetite to do this in current government, which is why, you know, civil society, trade unions, citizens, you know, whatever pressure can be put on government to start taking this seriously. We have this sort of mismatch, don't we, between, on the one hand, the sense of older people as innovators, as consumers, and the focus of, you know, on aging and innovation. On the other hand, aging and vulnerability goes hand in hand with that. Let's just try and join those ideas together and produce something much more coherent.
Thank you. And if I can add, maybe there's more for the UK government to learn from the devolved governments like Wales, which has had Old People's Commissioner and a Declaration of Rights for older people for quite a long time now. Thank you both, and thank you everyone for your questions. We are out of time. Time flies in these webinars. I would like to give a big thanks again to Amy and Tom for both presenting some fascinating work insights. It's a real pleasure, and we're really delighted that you could be part of our online forum today. And we're really pleased that everyone could join us. It's great to see such a huge turnout. I think at one point we had 121 attendees. So that's such a great response for our first online forum. We will be staying online for the time being, and we'll be getting in touch with people on our membership list to get your feedback about how that's working, how we might do it differently, how we might improve this. Just to mention that our next forum is scheduled for the 15th of September, 2 to 4 p.m. It'll probably be a little bit shorter because we'll be online again. And we flagged up that we're going to focus on technology and older people's use of technology. And it's looking like we're going to stick with that topic, again, because it's got such relevance and currency to people's experiences during lockdown and the ways in which that can impact on older people's inclusion within their communities and society. So thank you all, and we look forward to seeing you at the next forum. Hopefully people can easily find their way out of the Collaborate session, and we look forward to seeing you all next time.